There is your question. Right. So if you have read and understood, considering it history taking station, kindly please begin.
Hello, I am Dr. Ali, one of the surgical team. How are you, Mrs. Anne?
I'm okay, thank you.
The patient is admitted in my ward, right?
Yes, yes. So you've addressed it rightly. Good. Continue.
Okay. Fine, fine. It's great that you are fine, Mr. Anne, Mrs. Anne. I need you to ask you some questions to test your memory. This occurs you?
Yes, okay, good.
Regarding our place, first regarding our time, do you know what is the time now?
It's midnight.
Okay, what is our nearest around that?
12 p.m. 12 a.m.
Okay. Where we are now, Mrs. Anne?
In the hospital.
Okay, in which country?
UK.
Okay. I need you to count from 20 to 1 backward. You can do it.
20,
Okay.
18, 17, 16,
Okay.
14.
Thank you. Thank you.
Okay.
What is your date of birth?
February the 4th.
Excuse me? You can remember.
Yes, February the 4th, 95, 59.
59. Okay. And what is the year this year?
2023.
92. Okay. Do you know when the World War II ended?
I can't remember.
Okay, I will inform you address of a street now. I need you to keep it in your mind and I'll ask you later. Okay?
Okay.
The address is 24 Western Street. Keep it. You can repeat for me? 24?
24 Western Street.
Okay. Do you know who is our Prime Minister now?
No, I can't remember.
Okay. Could you tell me what's the address I told you previously?
Oh, I'm sorry. I really forgot.
Oh, okay. I think I finished the abbreviated mental status
No, one
examination.
question you can ask. What is my job? Do you know who
Yes,
I am?
I'm sorry.
Yes.
Okay. Yes. Do you know who I am?
Yes, you are a doctor.
Okay, and regarding this ma'am, what is her job?
She's a nurse.
Yes, thank you. I did my abbreviated mental state examination. The patient seems to 2 out of 10. The patient looks to be
Okay.
confused and maybe acute delirium or acute dementia. So to complete my assessment, I'd like to do a mini mental status examination. Should I
All right.
proceed for it?
No, consider. Do you think patient
Okay.
is fit for the operation?
Okay.
Is patient fit to give consent?
Excuse me?
Do you think patient
No,
is fit to
the
give
patient.
consent? Yes.
No, the patient is confused and mostly dementia or delirium. So she lacks the capacity to sign the consent.
Should the operation go ahead? Is it life-saving? Is it compulsory that it should go
If
ahead?
it's life-threatening condition, we can sign the consent for and with 2 consultant signature on it.
Okay. But in her case, in this patient's case, it's not an urgent procedure.
Yes, if it is not it's urgent, we should first stabilize the patient and solve what happened, and then we can delay postpone the procedure.
Good. So what are the differential diagnoses that you consider or you think patient is suffering from?
Regarding the history, the patient is diabetic, so we can consider metabolic causes like hypoglycemia, hypercalcemia, even hypoxia or hypercapnia, maybe hyperthyroidism or hypothyroidism. Other metabolic causes like liver dysfunction or uremia, electrolyte disturbance, or we can consider central problems like brain hemorrhage, brain tumor, meningitis, encephalitis, specific lesion, increasing intracranial pressure.
Okay, good. Can you suggest how should we manage this patient?
Firstly, we should ensure that the patient is stable so that we should follow the ABCD assessment, ensure that the patient airway is intact and his breathing adequate circulation, and his level of consciousness is best. And after that, we can start regarding what we find. First, we can take some labs from the patient regarding full blood count with hemoglobin, his white count, platelet, coagulation profile, his urea and the create liver function, and doing for him some investigation like CT or even maybe need CSF analysis.
Okay, the most important, yes, the most important one is to complete the history. After patient, you'll take the notes from family members and also you'll gather the information from GP. And then you'll perform a thorough systemic examination. Then these investigations that you are talking about, and what else? What images do you need? Yes.
Regarding the investigation?
Yes, please.
Yes, we told about CT brain.
Yes.
And CSF, and we can also do MRI brain.
Yes.
The ABG and the ECG for patient is chest X-ray and abdominal X-ray.
Yes, and more important one is midstream urine sample, because you have to rule out if the patient is not suffering from any urinary tract infection or anything which might have caused the confusion.
Yes, we can.
All right, and you'll also consider asking the medical registrar to see the patient, either take over or give appropriate, because you are this patient is not surgical patient, does not need to be operated right away. So you'll refer it to the medical registrar so they can take it over the patient and they can manage the patient until patient stabilizes and then can be operated. Very good. So this is something very important. to note. Good.